Hey, Dr. Tyler Williams at Pinecrest Dental. Thanks for being back on video today, and you're probably here because you have some questions about dental crowns or dental work. Maybe you have an ugly crown or a crown that feels too bulky or big, which is a very common question. Or maybe you went to the dentist, it's been a few years, and you showed up and they told you need a whole bunch of crowns done and you're not having any pain or sensitivity. Or it's just kind of a new experience for you. You want to make sure you're making the right decision. So the first recommendation that I'll have is make sure you can see photos of the problems, okay? Not just x-rays, but photos, okay? So you want to work with an office that uses an intraoral camera, a special camera that goes in your mouth, and can take pictures so you can look on the screen together with your doctor, your dentist, your dental team, be able to see what's actually going on. So that they're transparent. And then the second thing is you want to avoid crowns whenever possible. Now that may sound like a shock. You may have had a root canal before, had a big hole in your tooth, and you're like, oh, that probably needs a crown, right? But with crowns, they generally, 90+% of the time, they're too aggressive. They weaken your teeth, they make them more sensitive. You have to grind your tooth down to a little tiny stub. That little stub is more prone to fracture, become an implant, need a root canal, and they can almost always be avoided. Now, 20, 30, 40 years ago, crowns were the best technology, so it doesn't mean that they're bad, it just means there are better ways now, and we do what's called an overlay, and it's ceramic, which crowns are different types of ceramic, but an overlay is a special type of ceramic. It's all white, there's no metal, it's bonded to your tooth, and it's basically like putting a hat on top of your tooth, whereas a crown is like putting a roof with 4 walls over your tooth. You just want that hat or just that roof over the top. And what that does is it saves more than twice as much of your tooth. Your chance of root canal decreases by 3 times, and it's incredibly strong. It also feels more natural. The process is very unique. It's very specialized. It takes a lot of time to learn how to do these. Most offices have not learned the biomimetic or the overlay protocol because it takes more time to do, and typically you don't charge much more, if any more at all. In fact, it's usually less money because most of the time when you have to get a crown done, you also have to get a root canal, and our success rate of these without root canals is so high that it's probably only about 1 in every 30 to 50 of these that end up needing a root canal. Now, if you've already had a root canal, you can still get an overlay. It's still the #1 option of choice for us. If you have an old crown that's existing, then typically you'll have to get a crown. You won't qualify for an overlay because that piece of parts of your tooth have already been removed. The structure's already been removed. But you still have the opportunity to get a bonded crown rather than just a regular crown or a cemented crown, which is very strong, and it saves more of your tooth, and hopefully you don't have to get more of your tooth ground away. So if you have some questions about that, please call our office. If you'd like a consultation, second opinion, you can let us know. We can help you get that set up, and we'll sit down with you one-on-one, show you the photos in your mouth so that we can be transparent, show you exactly what's going on, and help you see and learn a better way of getting your teeth and mouth treated than getting crowns. So thanks for watching this video, and we'll see you next time.